This is part 7 of 9 intentional childhood injuries, and we'll address lead poisoning. Lead poisoning is quite interesting because when we ingest lead, it has a half-life of 20 years. Thinking back on your pharmacology courses, remember that it takes 3 to 5 half-lives to excrete a drug. Therefore, if the half-life is 20 years, it can take between 60 and 100 years to be able to excrete lead. Common sources are from lead pipes as well as lead paint. In the Orange County area, homes built before 1978 are full of lead-based paint. So when people go to remodel those homes and toddlers and infants are running around and the paint chips or little particles are floating around, you remember they put all that stuff in their mouth, and that's where they get poisoned. Lead poisoning affects close to 500,000 children in the United States. The signs and symptoms of lead poisoning: irritability, loss of appetite, belly pain, vomiting, constipation. That sounds like a lot of other things. And so who has that on their radar when a kid comes in complaining of that? The pediatricians are thinking a virus, a bacterial infection, and they're not really thinking lead poisoning. However, if the child also looks pale, and we're going to see in a couple more slides what we might see on a CBC, that's where they're going to start thinking about lead poisoning. And a real serious thing is that lead poisoning causes learning difficulties as well as behavior problems. Healthy People 2020 has a goal to prevent and screen children for lead poisoning. In Orange County, because the prevalence isn't as high as in other areas of the country, it's recommended that we test children at 12 months of age and then again at 24 months of age. In other parts of the country, they're also screening again at 3 years of age. The desired level is less than 5 micrograms per deciliter. And you have to keep in mind that lead poisoning is irreversible and permanent. The link I have on this slide is what parents need to know about lead poisoning, the risks, and to be on alert for things that might be in the household. If they have toys that are painted, they have to really turn them over and see where they were made. In the last 2 years, there was a huge cohort of trucks, little toy trucks that came in that were sold at Toys R Us, and they came from China and they had lead-based paint, so they were all recalled. When they are doing remodeling, it is recommended that if they're living in a home that has the lead-based paint and pipes, that they actually relocate until the home is completely rebuilt. And if the parents or family members are the ones that are redoing this house, be sure to change their clothes before touching the child, because the little flecks from the lead-based paint will get on the kid's skin and they'll ingest it. So the greatest danger in the lead poisoning is being able to recognize when it's there, but it's very difficult. Sometimes these kids will come in with a new seizure, and like I said, they have vague GI symptoms. So because the half-life is so long and the poisoning isn't recognized early, it can lead to depression, a decreased IQ, hearing loss, and behavior disorders. If we have an acute lead poisoning that we actually can find, the neurologic damage occurs in the kids less than 6 years of age because they're the most vulnerable to the brain damage. They develop learning disabilities, they have problems with speech and language, and then the behavior disorders is that they have hyperactivity disorder. If it's severe ingestion, they can have progressive encephalopathy that leads to coma and death. These kids will have decreased coordination and they have impaired growth of their muscles. And then they have an anemia. So when the bones are damaged, remember the bone marrow is what promotes our stem cells and we get into all of our cell lines of our RBCs and our white cells and our platelets. And so if they're full of lead, they are not producing these cells. It can cause hearing issues as well as renal damage. When you look at the picture on this slide, those wide white bands, that is actually lead that is deposited in the end plates of the bones. If it is an acute poisoning that's affected their airway, then of course we're going to intubate. The labs that get sent off, we're going to get a lead level and a CBC. On the lead levels, toxic levels are considered over 10. Between 5 and 10 is iffy, but over 10, it's elevated. But when we get to have levels that are over 45 micrograms per deciliter, that's when we're going to start seeing the airway impairment and the coma and possibility of death. And treatment needs to be implemented. And a blood rise from a 10 microgram to 20 micrograms, so change that. It's not MKG and it's not MPG. It's the computer that doesn't recognize the MCG. So from 10 micrograms to 20 micrograms causes the child's IQ level to drop by 2 to 3 points. So what is that doing to the kid who has the level of 45? I don't even think they've been able to determine that in the studies because hopefully kids aren't getting that much. So what we're looking at also on the CBC is when they start looking at the particular red cells is they're going to see what we call basophilic stippling. You do not have to remember that. So we treat the kid with some IV therapy and then we also begin chelation therapy. What chelation therapy does is it binds the iron so that it can be excreted. But remember, 20 years to get rid of it. More than 20 years, 60, 100 years. So the preferred method is to give them EDTA IV, and the other one is BAL. That has to be given IM. It is an oil, and it has to be deposited deep IM, and it has to be given every single day for about a month. And so imagine giving that to a toddler, which I had to do one time when I was working peds in Chicago. And now I'm wondering, what is the final outcome for this poor child because she was only 2 years old? So we will monitor their renal and their liver function. And we can initiate therapy inpatient as well as outpatient because they can come in for those injections. They can also come in for their infusions. Bottom line is, let's prevent it. So this ends lead poisoning.